The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. It is a Tuesday morning, and we are gathered here for the next episode of TMD Demystified. My name is Tony Urbanek. Today, we're going to be talking about a topic that I have reserved for quite a while. I find it extremely interesting. It has a very interesting story to go along with it. And I think that you may be very surprised about what some of the symptoms that can occur with TMD that no one really expects when you understand actually the pathophysiology of this disease. That's been the problem for the past 70 years, is no one has actually nailed down the actual pathophysiology of TMD. They talk about muscle tightness, they talk about trismus, they talk about trigger points, wearing out a muscle because of too much bruxism, too much motion. It's the theory, and it is a theory, generated basically in 1969 by Dr. Danny Laskin, the myofascial pain dysfunction syndrome theory, which I've spoken on before. I won't go into it any deeper, but it all revolves around the concept that too much bruxism causes a muscle to wear out, tire out, get painful, and that causes TMD. But no one really addresses all of the other symptoms that are well known, associated with temporomandibular joint disorder. You know, we know that doctors that treat this or attempt to treat it know that tinnitus, subjective hearing loss, and vertigo are also associated with TMD. And everyone just kind of scratches their head and rolls their eyes and shakes their head and says, I don't know what's going on. Or that neck pain is the second most common symptom of TMD. Well, what does neck pain have to do with too much bruxism? Well, frankly, nothing. But no one, I don't think, has ever asked those questions, but I have. I've asked those questions quite some time ago when I decided that surgery was not the long-term solution for TMD, and I did my own research project to figure out what the actual pathophysiology is. I didn't know whether I could. I didn't know whether I'd be successful, but fortunately, I was successful. And I've explained that many other episodes of this podcast. But today, we're going to talk about a single symptom that I have uncovered that is very, very interesting, that actually proves the point that chronic inflammation in the joint, in this joint, temporomandibular joint, creates all the symptoms. Proves the point, and that trigger points and too much bruxism and muscle tiredness doesn't have anything to do with creating these symptoms. So the topic for today's presentation is TMD can feel like you are having a heart attack. Does that surprise you? I'll tell the story, but actually, we have had episodes of patients. We've had experience now with 3 separate patients who have documented TMD, have most or all of the other symptoms associated with temporomandibular joint disorder, who relate that they thought they were having a heart attack. And I'm going to explain to you the pathophysiology, exactly how that occurs. So the story is that several years ago, I had a patient present to the office for consultation regarding TMD. His dentist thought that the patient had enough symptoms that they sent the patient in to see me to do a consultation and to see if I could help the patient. In the middle of that consultation, the patient shared with me a story that recently for him, he had actually gone to the emergency room, the emergency department of the local hospital, because he was having a heart attack because his chest was hurting so severely. His chest was hurting so severely. So I listened to that. I kind of filed it away. At the time, it didn't make any sense to me. He had all the other symptoms of the problem. He had hot joints, painful joints. He had frequent or recurring headaches, earaches, neck pain, jaw pain. And this funny story that he actually recently went to the emergency department and thought he was having a heart attack. Well, I filed it away. I didn't do anything with it until about a year and a half, 2 years later, another patient, female, comes in. And in the middle of the consultation, she shared with me part of her history that she had recently presented to the emergency room at a local hospital with chest pain and thought she was having a heart attack, and how that the emergency department worked her up and did the ECG, drew some blood to see what the troponin levels were. Troponin levels L and I would indicate muscle damage, and they are all normal. They were normal. But like the first patient, this patient had all the symptoms of TMD: frequent or recurring headache, earache, jaw pain, neck pain, tinnitus, subjective hearing loss, vertigo, upper back and shoulder pain, arm, hand, finger tingling, and numbness, which is one of the lesser known symptoms of TMD, which I will explain shortly, and various kinds of jaw locking, inability to open, what we call closed lock, where you go to open and you can't open all the way. There are various types of those. She had all of them, and this history she presented to the emergency department. I got very interested in thinking about it. I recalled the other patient I had 2 years earlier, and not within 6 months, a third patient presented to my office with the same history. Again, a female with most of the TMD symptoms and a history of presenting to the emergency department, emergency room at the local hospital, thinking she was having a heart attack because her chest hurt so much, which the subsequent workup, again, was totally negative. Troponins were normal, ECG was normal. They sent her home with some anti-inflammatories. It's like, if you go to the emergency room, you're going to come home with something. I don't know what they're going to give you, but they're going to find something to give you to send you home when they can't find anything else. All right, so let me explain how in the heck. I mean, I got very, very interested in this. Could that really happen? Could someone have chest pain associated with TMD? Could that be actually something that could occur? So I went back to the books. I went back to my anatomy books, Gray's Anatomy, went back to my experience in cell biology. I already knew the actual pathophysiology, which is when this joint becomes damaged, it becomes inflamed. If it doesn't heal properly within a reasonable amount of time, the chronic inflammation changes characteristics into, the inflammation changes characteristics into chronic inflammation, which is a little different cellular characteristics, chronic inflammation. When that occurs, that signals the brain, lower levels of the brain, amygdala and brainstem, that this joint is damaged, it's inflamed. The brain then signals the muscles that move this joint to tighten up. And that is why one of the most common symptoms is jaw pain or facial pain, where the muscles of mastication, and the muscles of mastication are attached here, as you know, temporalis, masseter at the zygoma, masseter at the inferior border of the mandible, mylohyoid underneath the mandible, internal and external pterygoids, not over the joint, but in front of the joint. And that's where, and even across here, masseter can insert in the zygoma forward and pull on the bone. And wherever those muscles of mastication pull on the bone is where it hurts, because that's where the nociceptors on the periosteum are stimulated, which go back to the brain as a sensation of pain. So you have a brain indicating and sending signals to the muscles of mastication that says, I'm inflamed, I'm damaged. The brain says, don't move the jaw joint, don't move the joint, tighten up, hold the jaw joint still to help it heal. That is the pathophysiology, but it goes further than that, because when the joint doesn't heal, you keep bruxing. Bruxing is associated certainly with TMD. One of the three causes of TMD is bruxism, acute trauma, and functional malocclusion. All of those damage the joint, but however the joint is damaged, it becomes inflamed, sends signals to the brain. Brain says, I'll help you out, don't move the jaw joint. But when it does not heal and you continue to brux, the brain keeps getting the signals. I'm inflamed, I'm damaged. The brain says, I told you, hold the muscles of mastication, facial muscles tight. Now hold the whole head tight, tighten up, don't move. And that's why neck pain is the second most common symptom of TMD. The second most common symptom of TMD is neck pain, but it goes further than that. It goes further than that, because when it continues on, and this can go on over years or months, the muscles get tight in the jaw, in the face, the muscles get tight in the neck, and then the signals come down. I told you, hold the jaw tight, hold the neck tight. Now I want you to tighten the entire upper shoulder girdle, as we call it. And when that happens, the neck muscles on the side of the neck get tight, and they squeeze the brachial plexus. And that is why, and the brachial plexus innervates the arm, hand, and finger, both for motion and feeling. And the brachial plexus then is squeezed, and patients will complain when they have inflammation in this joint of arm, hand, finger tingling and numbness. Now, let me share my screen. I want to Sorry about that. This is out of Gray's Anatomy. This is my copy of Gray's Anatomy, dated 1953, which is gifted to me by the chairman of the Department of Anatomy at Indiana University when he found out that I couldn't afford my own copy of Gray's Anatomy. These are the scalene muscles. Through the scalene muscles come the brachial plexus. Brachial plexus comes underneath the deltoid down into the arm, and when these muscles get the signal to tighten up, they cause arm, hand, finger tingling and numbness. But I want you to take a look at the anterior part, or the front part of this diagram. Off of the brachial plexus also comes major nerves to the pectoralis major and pectoralis minor. And when those muscles get signals to tighten up, they pull on the bone. And when they get signals to tighten up, it can cause enough pain that the patient is actually thinking they are having a heart attack associated with inflammation within the temporomandibular joint. Isn't that unique? Isn't that very, very unique? But it all came from listening to my patients, listening to their history, and not looking at it too deeply at first, but when I heard it 3 times, I got very interested. And it's obvious that just like arm, hand, finger tingling and numbness can be caused by the neck muscles squeezing the brachial plexus. At times, enough pressure can be placed on the brachial plexus that the patients complain of chest pain, end up in the emergency room with no obvious heart attack. Results of the workup are normal, but they have chest pain to the point that they think they're having a heart attack. Fascinating. And if you trace it back, it has nothing more or nothing less to do than inflammation within this joint. So that is the mechanism which creates all the disparate symptoms. It's the same mechanism that can, not very often, I've only had 3 cases out of over 5,000 patients I have treated with this disease, non-surgically, with the device that does nothing more, nothing less than unload the temporomandibular joint by separating the teeth according to a protocol, separating the posterior teeth, and allowing the inflammation within the temporomandibular joint to decrease to the point where it stops sending signals to the brain that says, I'm inflamed. It's all about inflammation. Inflammation is intimately involved with the endocrine system. It's intimately involved, obviously, with the nervous system. So it's a very, very complicated system, but when you look at it in its entirety, it makes sense. It explains why you can have these disparate symptoms. All right, I won't belabor the point. I hope this you found interesting. I hope you can use it. I think if anyone out there has had an episode of chest pain that turned out to be normal on workup, I'd like to know about it. Please contact me. I can be reached at tony@tmjservices.net. Our website is www.urbanektmj.com. If you'd like to become a member of our network of doctors who are licensed to use this device, which has a patent on it, FDA clearance, manufactured in an FDA-approved good manufacturing practice laboratory. There's very few of those in the country. Our laboratory is one of the very few, I think, out of 9,000 laboratories, dental labs in the country. Our lab, which does nothing more than make this device, is one of only a few hundred, maybe less than 100 labs that have already received FDA good manufacturing practices approval and clearance. Next time, we will be talking about a topic, hopefully, that has mutual interest. And by the way, I want to make clear, make it absolutely clear for liability purposes, if you have chest pain, you do need to go to the emergency department and not think offhandedly that it's TMD. If you're having chest pain, the first thing to do is either call 911 or make it a rapid transit to the nearest emergency department to have a reasonable workup. For sure, don't automatically think it's TMD. All right, till next time, I am Tony Urbanek, and the name of this podcast is TMD Demystified.